So friends, now we would talk about our next topic, that is the photodynamic therapy. Now what is photodynamic therapy? It is a mode of treatment modality for wet ARMD. Okay, so there are two types of ARMD. One is a wet ARMD, that is here, and one is a dry ARMD. Now how to differentiate between that? Can you see here there is a membrane beneath the retina, and this is because of the new vessels that are basically growing from the Bruch membrane. Okay, Bruch membrane is the layer of choroid. So from the choroid these new vessels are growing towards the retina, and this is basically a dry RMD. Can you see here these deposits? So basically these deposits are called drusen's, and in dry RMD you get drusen's in the retina. So now we come back to our main topic, that is a wet ARMD. In the picture like wet ARMD, you have a membrane beneath the retina, and when you do a fluorescein angiography you find a leakage and a blood vessel like appearance, or a, a whitish type of lesion at the macula. So because of the leakage, these new vessels, that are the choroidal new vessels, are basically leaky vessels. They don't have a very good junctions. So where is the use of PDT? Basically the use of PDT or the photodynamic therapy is in the wet ARMD. Now we come to our next topic, that is what is the PDT and how it is done. So remember friends, the basically in PDT we give a intravenous dye, which is a a photosensitive dye. We call it vertiporphyrin. Some new studies have seen that another dye, that is rostaporphyrin, can also be used. So remember for AIMS exams that you have two dyes, one is vertiporphyrin and second is rostaporphyrin. Basically you give this dye intravenously for 10 minutes and then you do a diode laser at the junction. So let's say this is your eye, this is your optic nerve head, and this is your macula where there is a membrane, there is a CNV or the choroidal neovascular membrane. So after giving the dye, this dye can accumulate in this lesion, and then we bombard this lesion with a diode laser. Okay, so what happens with this diode laser? That this diode laser basically then, with the help of cytotoxicity and with the help of thrombosis, it basically what it does is it basically kills the new vessels, or it basically what it does is that it hampers the growth of new vessels. Okay, so this happens with the photodynamic therapy, so hampers growth of new vessels. Now the question asked here was that after a photodynamic therapy, that what should be the color of lesion. So this is a controversial question. I don't know that whether this question was asked for your eye or whether it is asked for your any other lesion. Or photodynamic therapy is done in many cases. It's not that it is done only for ophthalmology. With for very various dermatological reasons it is also seen. So now I restrict myself to the basically eye lesion. So if you can see, these are the serial photographs that are being taken after a photodynamic therapy. This is a immediate, this is taken immediately, let's say within 24 hours, then it is around 48 hours or 72 hours, and this is within around 5 days or 7 days, and this is basically after 9 months. So if you can see here that after a photodynamic therapy, initially there is a slight bleaching, but there is no change in the color. But after 48 to 72 hours, definitely there is a whitening of the lesion. Okay, so if they ask that what is the color change immediately, what I would suggest is, in eye there is no change, so initially the change remains unchanged, but within few hours it starts to get a slight whitening of the lesion, and by 48 hours it definitely whitens. So if they ask what is the color after 48 to 72 hours, you would write yes, whitening of the lesion. And if they say that what is the color of lesion after a few weeks or few months, then definitely there would be a hyperpigmented lesion after a PDT laser. Okay, the similar thing happens with the your pan-retinal photocoagulation also. So when you do a laser, initially there is a bleaching and whitening of the lesion, and when you see these lesions after few months, they become hyperpigmented. Okay.